Okay guys, a little information about lumbar spine stenosis. Just for clarification, I told you I would send you something. This is a great example of a CT scan showing the stenotic central canal here. So you see the spinous process here, transverse processes are really not noted, but here you have the facet joints. These are hypertrophied. You can see the whiteness on the edge here is much thicker than normal right here. That means those are degenerative. That's that osteoarthrosis of the joint, okay, of the inferior and superior facet here. So this area is where the spinal cord is, right here. You can see it, this small little area. Root coming out to the side. So what I want you to notice here is with degeneration, what happens is this structure, the facet joint, has a ligament around it, okay, like all joints do. And because of the pancaking of the disc, so if you can imagine using two ping pong paddles and a water balloon, for example. If you put a water balloon between the ping pong paddles and then squish them together, they're going to come out the side. So here this white, you can see the cortical ring of the vertebral body here. But outside of that, this right here is the disc. So because you've lost disc height, it's pushing out to the side just like a balloon between ping pong paddles. And you can see how its margin is very different than the cortical portion of the vertebra. So we're getting compression from the anterior, and we're getting compression from the posterior as well from the increased size, or really because of the pancaking here, the ligaments around this facet joint aren't tight like they should be. They're also collapsed, which means they're going to push into the canal from the back, and you're going to get this pancaking that pushes from the front. So you get a very much a squeezing of the canal. So that's just kind of what it looks like. Now I'm going to show you two pictures here. I want you to decide which one you feel is more likely to result in symptomatic stenosis of the spine. So let's look at this one first. What we see is a cross section through the sagittal plane where we're getting a compression of the cord. So here is a normal cord, here's normal cord, we're getting a little bit here at L5S1, right? See that? But we're getting much more at L4-5 and L3-4. And in fact, this is the most common presentation clinically and on radiographs here. L3-4 plus L4-5. All right, and because of that, we get two concurrent levels of compression on the spinal cord. You see that? And that's going to cause a shutting down of the vascularization of the spinal cord. On the other hand, if we look at this picture, yes, we do have stenosis. What is stenosis? It's a narrowing of the canal. Here it is. But what is this? Here's L5S1. Here's L3-4. This is due to, you can see, herniated disc, right? So the point here is that this one is only one level. See, it's normal up here at L3-4, relatively normal at L5S1. So the point is that when it's two level like this versus one level like this, the two level is going to be a symptomatic spinal stenosis where people get the cramping, the sensory changes and so forth down in their legs. The cramping and pain, not sensory changes, cramping and pain down in their buttock and legs. Because when they stand, this is going to be, the vascular area is going to be compromised. If you reverse this and go flex forward, it's going to unravel this, right? There's going to be increased space within the canal, when we bend forward. That's why they like to flex. But this is going to be symptomatic, where this one, they may be symptomatic from a disc standpoint, but not from a stenosis standpoint. Yes, there is stenosis, but not clinical symptomatic stenosis that causes that crampy pain in the buttocks and the legs. Because, just like everywhere else in the body, if we get decreased blood supply to an area, there's collateral circulation from above and below, here, right? So if we just have one level, the blood supply from the bottom and the blood supply from the top should be adequate to keep people from having those symptoms. Where from this one, collateral blood supply is not going to get it done for this central area. Does that make sense? So that's the difference between them, and that's what it looks like with pathology that is symptomatic. Pathology that's symptomatic and pathology that is not symptomatic as far as stenosis goes. So if we put those together, here's a normal disc. See it? It's nice shape. All those lamina are lined up together. The facet joint is normal, and there's plenty of space. However, look at this. With degeneration, it causes hypertrophy of the facet, and then that tissue around it, the capsule, because of the bulging, you can see the bulging of the disc like that water balloon between two ping pong battles. It's pushing from the back, from the front, and it's pushing from the back, and that squeezes the container. Okay, hope that makes sense to you guys. Have a great day.